Hello, everyone, and welcome to this week's episode of the Ask Dr. Murphy series. I hope you all are doing very well. My name is Katie Berg, and I'll be leading today's discussion. I'm a research study coordinator here with the Havey Institute. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
I'm doing just fine. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health, as well as the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your questions related to COVID, public health, and infectious diseases each Thursday here on the Havey Institute Facebook page. Please feel free to submit any questions you have to the Global Health Institute new Instagram, Twitter, Facebook, YouTube, or any of our social medias linked below. Today, Dr. Murphy is answering a viewer-submitted question and addressing the latest COVID headlines through today, September 6th. Starting with the US COVID statistics, average cases per day are around 10,300, though we have not received those measures since mid-May. Average new hospitalizations per day are 2,152. Average COVID deaths per day are 51.5, and new booster proportion has stayed steady at 17%. Dr. Murphy, your reaction to those numbers?
Well, they keep going up week after week. These are significant. It's still small numbers, but it's significant increases, 18%, 19%. And the average number of deaths per day, if you remember, just over the last couple of weeks has doubled. It was 25, now it's 51. The booster should stay low, but remember, next week, the booster is likely to be available, the new booster, the Omicron booster. And I think that's why a lot of that number hasn't budged, because everybody's waiting for this new vaccine to come out, the people that are going to take a vaccine. I highly recommend it because it's geared specifically for the viruses that are circulating right now in the United States. So when that comes out, if you're at risk, everyone should take it, but the people at risk should, step to the front of the line.
Absolutely. And there was some interesting news that came out this week regarding how deadly the Omicron variant has been, and also the status of some of the most prominent variants. Can you tell us a little bit about that?
Yeah, so it was a study in France. France has basically a gigantic Medicare system for all. Everybody has the same basic insurance, and then they have supplemental insurance, just like we do here. Everyone is in a pretty much everybody is in a national database. And so they can look at, everybody in the country and see what's happened with them, what their death rates are. It's very similar to our Veterans Administration medical record system. But we don't have that for the whole US population, whereas it's for the entire French population. And so what they did is they looked in late 2022 and early 2023, and they looked at the reported deaths from COVID and flu, and they found out that it was 4 times higher than flu. So COVID is a nastier animal here. If you're taking a flu vaccine, if you believe in the flu vaccine, you should take the COVID vaccine. If for some reason you don't like the mRNA vaccines, Novavax has a regular design vaccine. You can take that. It probably works just as well. So that is really what's going on. So I think that was kind of a nice data presentation in a well-controlled population.
Absolutely. And moving on to our viewer submitted question for the week, our viewers were wondering regarding the issue of COVID misinformation throughout the pandemic being shared by, in some cases, doctors on social media or elsewhere. What was, were there consequences of that? And if so, what were they?
Well, yes, there was some of that. It kind of started with the Great Barrington Declaration, which was a Koch brothers funded entity of non-academic physicians who didn't want to follow the guidelines of the legitimate infectious disease and epidemiology and public health people in the United States. It was mostly economically oriented, but it included people that were QAnon followers and all sorts of other kind of, outsider thinking. So many of them were investigated, and 20 doctors in the country, that's not very many considering how many doctors there are, but 20 were disciplined for complaints of COVID misinformation. It's okay to not believe in it, but if you're going to, you have a respected place in the community, you cannot give misinformation. That is against every ethics rule. 5 of those physicians actually lost their medical licenses. It was so bad. One was revoked and 4 surrendered theirs, and medical boards in at least 14 states have taken disciplinary action against 1 or more physicians. So these numbers are small, but these people really cause a lot of damage, considering how small really the group is. And so there are consequences if you spread misinformation.
Absolutely. And it's good to hear. I don't often hear news about, the consequences of that. So that's reassuring to know.
Mm-hmm.
Moving on to our headlines this week, there was a very interesting study published on high levels of some blood clotting proteins and their relation to post-COVID brain fog. Could you break down that research for us a bit?
Yeah, this is a result of the actual scientific study of people who are complaining of long COVID, particularly those with brain fog. So a study in the United Kingdom, published in Nature Medicine, a very respectable journal, and other studies have shown the same thing, including studies that have been done here. But anyway, they found that 2 blood biomarkers, notably fibrinogen and D-dimer, which is sort of relative to C-reactive protein, a kind of a general protein that gets stimulated when you have any kind of infection going on. So these are not specific, but these are markers of something bad going on. And they showed that these could predict cognitive dysfunction, which is the medical term for brain fog, in COVID survivors 6 and 12 months following hospitalization. So, the people that are complaining of brain fog and then they do these tests are elevated. This is like just weirdly abnormal. I mean, this is, you're not supposed to have levels of these things floating around, but at least it's maybe a marker that they can use to link back to COVID and make an appropriate diagnosis. So they identified these markers in a study of 1,800 adults in 2020 to 2021. The average age of the patients was 58 years. There were approximately twice as many men than women. This mimicked the results, as I mentioned, a U.S. study of 17,900 U.S. patients. And so that gives it, it verifies and supports the data that the Brits are reporting. Interestingly, when they looked closer at these patients, if they had pre-existing cognitive problems, so they were having brain fog to begin with, they didn't link to the brain fog of COVID. In other words, if they had brain fog before, it didn't get worse or something like that. So that was also kind of an interesting finding. And these are pretty simple tests to do. They're just a blood test. They're not super expensive. And maybe it can help in some management strategies at some particular point.
Absolutely. Thank you for breaking that down. And as we continue to receive more news about long COVID research, we will continue to talk about it. I know we have a lot of interest in that subject. But moving on, there was a very large announcement from the state of Virginia's health department that they were experiencing a serious outbreak of a meningococcal disease, excuse me. Can you please give us a breakdown of what the disease is and why this announcement came now.
So meningococcal disease is a rare illness caused by a bacteria, Neisseria meningitidis. And there's 6 types of these bacteria that cause most disease of around the world. And symptoms are pretty non-specific, but they include headache, fever, stiff neck. They have meningitis, so they have problems with the stiff neck, nausea, vomiting, sensitivity to light. And as the disease gets into the bloodstream, they get these what they call purpuric rashes, these dark purple rashes. And it can get very, very serious. And approximately 10 to 15% of people with meningococcal disease die. And 1 in 5 have long-term disabilities. They can have deafness. They actually can get such bad lesions, they can actually lose fingers or require amputations of the limb. They get brain damage, nervous system problems. I mean, it's a bad disease. And there have been outbreaks around the country and the world in the past. I remember there was a big one here in Champaign-Urbana many years ago, but I mean, it pops up. So in Virginia, they noticed that, there's a little bit more of these than usual. Once in a while you see it, but they had 27 cases. 5 of those people have died due to complications of the disease. There is a vaccine for meningococcal disease, and 26 of these patients were not vaccinated. And, so that's unfortunate because it's primarily a preventable disease if you take the vaccine. It just is, this is a high number of cases. We're still talking about 27, but, 5 people died, and many other people are really disabled from this. This is 3 times higher than kind of the expected number of cases that we see out there. So it's just another thing that you got to watch out for, another thing that can be prevented mostly by being vaccinated for it.
Absolutely. And sticking on the meningitis topic, but switching gears to fungal meningitis, there was news that came out recently about new antifungal therapy being successful in some trials. Can you tell us a little bit about what that trial was?
Yeah, this is a trial of an old drug used in a new formulation. So very serious fungal diseases. And the case that we're talking about here is cryptococcal meningitis. It's a very bad disease. It occurs in people with AIDS, with underlying immune conditions, and it's a very bad disease. And often you have to take intravenous amphotericin B. Very tough to take, hard on the kidneys. People hate it. It's a tough drug to take, but if it's going to save your life, you take it. So anyhow, so they have this new oral formulation that was tried out in this study. It was a randomized trial, 141 HIV-infected people with cryptococcal meningitis, got the oral amphotericin with the oral flucytosine, another antiviral drug. And they found that, hey, it worked just as good, if not a little better, and that it was much better tolerated than the IV formulation. So it's really, I mean, if once this gets out there, this is going to be great. And the CDC reports an estimated 152,000 cases globally every year of this cryptococcus disease. Now, amphotericin is used for a lot of other fungal diseases. So, but this is the first where they looked at this oral formulation. And they did the study with the researchers from the University of Minnesota Medical School and School of Public Health and the Infectious Disease Institute of Makerere University in Uganda, and in Matinas Biopharma, which must be the manufacturer of the oral formulation. So this is a big improvement in the antifungal world.
Yeah, that is very, very big news. And if you don't mind, I'd like to circle back to some of the COVID variants that are popping up. We've been having some interest in the BA 2.86 and the Eris variants that have been coming up. Do you know how those are tracking these days?
Yeah, so it's important that we track these because they it can involve the impact of potentially of testing of some of the treatments that are out there. The severity of disease can be different. Remember, Delta was actually more severe. So anyhow, so this BA 2.86 is floating around out there, but in the United States, it's only making up about 1% of the current circulating viruses. France and Scotland have reported their first detectable BA 2.86. And there's another 11 countries that had it. So, they thought it was really going to be spreading around. So 2.86 is more transmissible than the other one, supposedly, and it interacts at different levels with the immune responses. It was first identified in Beijing, China, at Peking University by Dr. Cao, Yulong Richard Cao, and his team found that the antibodies that protect you from the XBB, the other Omicron, the circulating variant, can significantly escape this, so those antibodies don't work. So that was kind of a scary thing, but it's kind of strange because it doesn't seem to be picking up as fast as the other circulating Omicron variants, like EG5, which now makes up 22% of all the cases in the United States, and other variants that are increased in recent weeks are the other Omicron variants, XBB 116, FL 151, and HV1. So, this could end up being another Lambda. This happened with, people probably don't remember it, but it was identified in Peru. And they thought the same kind of story they're telling here, and it just kind of pooped out and disappeared. So we just got to keep an eye on these variants and see, if which one is going to be taking over, and are they going to behave the same. So far, there's what the few reports that are out there is that it does behave about the same, but it's more transmissible.
Mm-hmm. And on that note, I'd like to thank you, Dr. Murphy, for your time and expertise in answering our viewer-submitted question and reacting to the headlines and U.S. COVID stats. So thank you, Dr. Murphy.
One last thing, don't forget, next week, the new vaccine will be out, supposedly in the United States.
Absolutely.
Monday, it's going to be launched in the UK. And supposedly, after this meeting on the 12th, this advisory panel, they'll release it 2 weeks earlier. That's what the plan, I think, is supposed to be. And we talked about that before, but we're getting the summer wave, and the summer wave is starting in the beginning of August. So there's no point waiting till September. Probably we're going to have to give the new COVID vaccines earlier than the flu vaccine.
Absolutely. That's a great reminder, and a general reminder as well to check up on those vaccines. Maybe it's the RSV vaccine, the flu vaccine, or the COVID booster. Keep those in mind, and thank you very much for watching.
All right, stay healthy.